Yo guys, welcome to our channel today. The channel is Nazvin. Like another day, we're going to discuss our matters sensitive, which affects our health as much as possible, and how to handle them. Today we're going to talk about something about how to increase the testicular size and also increase sperm production. How to increase testicular size and also increase sperm production. Guys, sit back. Matters testicular and also sperm production. That's what we're going to talk about today. The channel is Nazvin. My name is Vincent. This is where we get to talk matters medical in a simple language which you can always understand. That's why you don't need to be a medic to subscribe to the channel. You don't need to be a medic to share this widely, because whatever we share in this channel is something which even a lay person can get really to understand. So guys, when we talk about testicular size and also when we talk about sperm production, they go hand in hand. So increasing testicular size and sperm production involves a combination of lifestyle changes. We talk about diet. We talk about addressing an underlying health issues. That's very key when you want to handle this in a very good way. So I'm going to give you some strategies which can help to curb this. So number one is about when we talk about lifestyle changes. And number one in this, we talk about regular exercise. And when we talk about regular exercise, we mean physical activity, engaging in regular to moderate exercise, because it can boost testosterone levels and also improve the overall health, which can positively affect sperm production. So in our previous video, I talked about the role of testosterone in reproduction, and kindly, if you have not watched it, I want to encourage you to have a look at it, review, so that you can find out what happens with testosterone and its role in fertility issues. So and when we talk about regular exercise, we also need to avoid overtraining. Excessive exercise can be the opposite, can bring about the opposite effect. So it is important to maintain a balanced routine for physical exercise. Number two is about healthy weight. We talk about maintaining healthy BMI. So being overweight or underweight can negatively affect the hormone balance and also sperm production. So the fertility level is affected. Number three is avoid overexposure to heat, and also keep especially the testicles cool, because excess heat can impair sperm production. And also avoid hot tubs, saunas and tight underwear. That can increase scrotal temperature. And if you are one who is a fan for saunas and also hot tubs, you don't do it very regularly. So you do it within stipulated time. And also this you can seek a professional advice who can help you to come up with the best way in which you can always approach it. So reducing those hot temperatures is very key, where you get to improve your health by having those health production of those sperm. So also reduce that temperature. And also, if you are a fan of saunas like I've talked about, and hot tubs, use them sparingly or moderately, because that's how you can get to help yourself. Also very important, we talk about reducing stress. Reduce stress management is very key by practicing what I always talk about: meditation, yoga, or deep breathing exercises, as chronic stress can also lower sperm production. Number two is about dietary changes. Balanced diet, we talk about nutrients. Ensure rich vitamins and also minerals that support sperm health. And when we talk about minerals, we talk about zinc. We did a video on zinc previously, and if you have not watched the role of the zinc, especially in sperm production, you can also have a look at it, because it's very key. I also stated in that video, we talk about also the sources of zinc, which is very key on sperm production. So things like zinc, selenium, vitamin C, vitamin E, and folic acid, they are very key in sperm production. Number 2, we talk about specific foods, especially the zinc-rich foods. We talk about things like oysters, we talk about beef, we talk about pumpkin seeds, which are high in zinc. Also, we talk about antioxidants. So when we talk about antioxidants, mostly they are found in fruits, and also vegetables such as berries, citrus fruits, and also leafy greens. That's very key in sperm production. Hydration, stay hydrated, drink plenty of water to maintain overall health and support bodily functions, including sperm production at the end of the day. So this drinking that safe water for drinking is very key in sperm production. Also supplements, when we talk about supplement, we talk about zinc and also folate. When we talk about zinc, zinc is essential for testosterone production and sperm health, and also folate works with zinc to improve sperm quality. There's something I'm going to talk about also, what we call coenzyme Q10. When we talk about coenzyme like Q10 or CoQ10, is an antioxidant which improves sperm motility. When we talk about sperm motility, is the movement of those sperms, because when we talk about fertilization, the sperm needs to move from one point to the ova or the egg of the woman, so that the fertilization can take place. So the enzyme Q10 is very key in matters production. Well, we also talk about L-carnitine. When we talk about L-carnitine, is a very key amino acid which is found in red meat and dairy, which improve the sperm motility or sperm movement and also overall health. Very important also, when we talk about that, we talk about omega-3 fatty acids. This is where we talk about fish oil, which can improve sperm morphology and also motility. Also avoid very harmful substances when we talk about food. Tobacco is about quitting. Smoking can reduce sperm count and also quality. Alcohol, limit intake, because alcohol consumption can negatively affect sperm production. And also the use of recreational drugs is very dangerous, because these drugs like marijuana and anabolic steroids can lower sperm production. Also medical interventions which help in sperm production, and also the testicle size is very key when we talk about testosterone therapy, especially where you consult with your healthcare provider about hormonal treatments if you have a low testosterone levels, so that they can help you to come up with the strategies of the testosterone therapy, where you get to be replaced with the testosterone. Also addressing the medical conditions, underlying medical conditions like varicocele, which is the enlargement of veins within the scrotum that can impair sperm production. So surgical correction can improve sperm quality. Infections, treat any infections that might affect sperm production, such as sexually transmitted infections. That's very key. Regular checkups is also another strategy, where fertility specialists, which with regular visits to healthcare provider or fertility specialists, can help identify and address the underlying issues affecting sperm production. On general health, we talk about sleep. Adequate rest is very key to ensure get enough sleep. Sleep quality affects hormonal levels and also overall health. Avoiding toxins, especially environmental exposure. So you limit yourself to environmental toxins, especially if you are a farmer. You should take care of yourself and protect yourself against pesticides, heavy metals if you work in the industries, and also chemicals that impair sperm production. So by adopting these lifestyle changes, dietary changes, and also avoiding harmful substances and seeking medical advice when necessary, you can enhance testicular health and increase sperm production. So always consult with your healthcare provider before starting any new supplement or treatment as appropriate, because your healthcare provider needs to take you through some tests which can really help you to come up with a proper way of managing yourself in the best way possible. Very key also on when we talk about management, we talk about the lifestyle management, we talk about regular exercise, maintaining the healthy weight, because when we maintain the healthy weight, we balance the hormones and optimize the sperm production, avoiding the ET exposure. In this we encourage wearing loose underwear to avoid prolonged exposure to hot tubs. Also, saunas and testicle is allowed to cool down and promote optimal sperm production. Stress reduction is another practice. So practice stress management techniques like meditation, yoga, deep breathing exercises to lower the stress, which can improve the sperm production at the end of the day. So also dietary management, we talk about foods rich in zinc, selenium, vitamin C, vitamin E, and folic acid. We talk about specific foods. We talk about zinc-rich foods like oysters and pumpkins, beef, antioxidants such as the berries, citrus fruits, leafy greens, and also other colorful vegetables. Adequate hydration is also another key point, where you should drink a lot of water to hydrate and also support overall body functions, including sperm production. Supplements, we talk about zinc and folate, where if needed as appropriate with your healthcare provider can guide you. We talk about coenzyme Q10, which is very good in the sperm motility and also sperm count. Carnitine is also a very good supplement which can improve sperm motility and also quality. Omega-3 fatty acids is also another thing which is especially from the fish, especially to enhance the morphology and also motility of the sperms. Avoiding or quitting smoking is the other option. Also moderating your alcohol intake, because excessive alcohol intake can really affect sperm production. So moderation is very key. Avoiding recreational drugs like marijuana and anabolic steroids is very key. On medical interventions, we talk about you get especially testosterone therapy, which needs to help you. We also treat varicocele, surgical correction of varicocele, where we have abnormal veins, swelling of the veins at the part of the testicles. That's very key. And treatment of the STIs to prevent damage to reproductive system. Also very key. Regular checkups with the healthcare provider or specialists to monitor reproductive health and address any issues promptly. Overall health management is very key. Adequate sleep is very key. Avoiding environmental toxins. Health habits like avoid excessive use of electronics near the groin area. And practice safe exercise habits to avoid injury. So when you exercise, don't also overextend it. Track your progress is very key. Keep record of your lifestyle changes, like diet and supplements or treatments you are taking. Not any improvement if the symptoms or of your overall health is affected. Consult your healthcare provider is where you can be helped to adjust your management plan so that you based on your progress and on the new information. So sometimes we have some complications which come about with while trying to increase the testicular size and also sperm production. There can be complications or side effects, especially if the approach is by use of supplements, medications, or other interventions. So understanding potential complications can help in making informed decisions and also seeking appropriate medical advice. Potential complications, number one, we talk about hormonal imbalance, which comes about, especially with testosterone therapy. While testosterone therapy can help one to achieve the optimum level for testosterone, so it can also lead to imbalance if not properly monitored. So potential side effects include acne, also sleep apnea, and also increased risk of heart disease when one undergoes this testosterone therapy. Also, over-the-counter supplements may contain unregulated ingredients that can disrupt the hormonal balance. So that's very key also. Number 2 is about testicular atrophy, especially when one uses the steroid use, like anabolic steroids, often used for muscle building, can cause testicular atrophy or shrinking of the testicles and reduce the natural sperm production. Number 3 is varicocele surgery complications can come about when one gets that surgery. So varicose repair surgeries carries the risk for infection, bleeding and damage to the surrounding structures. In some cases, also even if the surgery has been done, varicocele can recur again. So that's a complication. Also nutrient toxicity, especially when one is on supplementation. Excessive overconsumption of certain supplements like zinc, selenium, vitamin C can lead to toxicity and adverse effect. For example, too much zinc can cause gastrointestinal issues and interfere with copper absorption at the end of the day. Also, we have sometimes allergic reactions because some supplements, some individuals may react. Some individuals may have allergic reactions because of one thing or the other one. So the one can develop hives, swellings, and also anaphylaxis at some point. So that's also another thing which one can really get to monitor. Prostate issues can also come up, enlarged prostate. So increased testosterone levels can cause benign prostate hyperplasia or a BPH, leading to urinary symptoms. Prostate cancer risk, there is ongoing debate about the link between testosterone therapy and also prostate cancer risk. So these things can also predispose you to cancer. Mental health impact, especially mood swings and depression. Hormonal treatments and supplements can sometimes affect the mood, leading to irritability and also anxiety or depression at the end of the day. Also, infections can be another complication, especially related to surgery, where any surgical intervention such as varicocele repair carries a risk for infection, which can complicate the recovery. Gastrointestinal issues, we have dietary and also supplements, where dietary or introduction of new supplements can cause gastrointestinal discomfort, such as bloating, we can have diarrhea or constipation at the end of the day. Also, interaction with medications, supplements or new medications can interact with the existing prescription, especially if one has the underlying conditions, and this can reduce the efficacy or causing adverse effects. So that's another, because of drug interactions. Sometimes if one has other underlying conditions, when these drugs interact, they can have other issues in the body. On the management and mitigation, so we want you to see your professional advice and also start gradually on the management. Proper dosage is very key. Balanced diet is another thing. Monitoring hormonal levels with the healthcare provider by undergoing hormonal treatments. Regular blood tests can help levels and adjust dosages as needed. Surgical consideration, risk benefits analysis is very key, where you weigh the potential benefits and also risk for surgical interventions with the healthcare provider to ensure that the procedure performed by a qualified specialist. Avoid self-medication. Prescription only is really needed here. Use of medication and hormonal treatments as prescribed by a healthcare professional to avoid complications. Lifestyle balance is very key, because moderate exercise is very key, where you need to do that moderate exercise, because also extreme physical activities can strain the body and affect the hormonal levels. While seeking testicular size and sperm production, it is crucial to be aware of the potential complications and also the steps to manage them very well. So those are the points which we need to look at. So if you want to supplement wisely. Routine health screening, hormonal balance is very key. Also avoiding environmental toxins, adequate rest, self-exercise practices to avoid any trauma, especially practice self-exercise habits to prevent injury to the testicles. Also wear protective gear when engaging in sports or activities that pose risk for that. Also sexuality is very key, where safe sex practices, especially protection, use of condoms to prevent the STIs, which can negatively impact the sperm health, Regular screening is another one. Get regular screening for STIs and other infections to maintain reproductive health. Education and awareness is also very key. Stay informed from the channel such as Nazvin, where you get health education to stay informed about your reproductive health and the factors that influence testicular size and also sperm production. Awareness of the symptom. Be aware of the symptoms that may indicate reproductive health issues, such as in testicular size, pain, also swelling, and seek medical advice if they occur. So guys, engage in regular moderate exercise, reduce stress through techniques like meditation, keep testicular cool by prolonged exposure, especially in the hot tubs and saunas. Diet which contains zinc, selenium, vitamin C, vitamin E, and folic acid. They are very key. Staying hydrated. Include antioxidant foods to protect the sperms from oxidative stress. Avoid harmful substances, quit smoking and also alcohol, and also refrain from using recreational drugs such as marijuana and anabolic steroids. So when using the supplements is also very key. You undergo a checkup with your healthcare provider. So consult healthcare providers before starting the end supplements. Consider zinc, folate, CoQ10L, carnitine, and also omega-3 fatty acids if recommended. Monitor and manage hormonal levels if experiencing symptoms of imbalance. That's very key also. Environmental and lifestyle adjustment is also another one, where you limit exposure to environmental toxins and also pesticides and also heavy metals such as lead. Ensure adequate sleep to maintain hormonal balance. Practice safe exercise habitude to avoid testicular injury. On sexual health, we talk about prevent the STIs through using the protective condoms, especially, and also getting regular checkups for screening for STIs and other infections. Education and awareness. Stay informed of the reproductive health and factors influencing the testicular size and also sperm production. Be aware of symptoms that may indicate reproductive health issues and also seek medical advice if they occur. So complications such as hormonal imbalances, testosterone, and also therapy or supplements, testicular atrophy for steroid use, surgical risks associated with varicocele repair, nutrient toxicity with and also excessive supplementation, allergic reactions also from hormonal treatments, cardiovascular issues, prostate problems, mental health impacts, and also including mood swings and depression, infection from surgical procedures, gastrointestinal issues and dietary supplements, interaction with existing medications are some of the complications which can come about in this. By following the comprehensive strategies, you enhance the testicular health and also optimize sperm production and maintain the overall reproductive well-being. Always consult with the healthcare professionals before making any significant changes to diet, lifestyle, and also starting any treatment or supplementation at the end of the day to ensure safety and also efficacy. Regular monitoring and also management are the key preventing complications that promote reproductive health. Guys, welcome. The channel has been kind. I want to also welcome you to our next video. Guys, I love you very much. Peace.